Hi everyone, my name is Sydney Mulholland, and I'm an occupational therapy student here at the American Stroke Foundation from the University of Kansas Medical Center. Today, this video is going to cover mental health. Here's the agenda for this video. We'll start by talking about the definition of mental health, its importance on overall health, changes that may occur with your mental health, factors affecting mental health, how this may look after a stroke, and how we can take care of ourselves. So what is mental health? I know sometimes it may seem like a buzzword, and there's lots of different definitions out there, but for the purpose of this video, we'll work on the CDC's definition of mental health. They say, mental health includes our emotional, psychological, and social well-being. It also affects how you think, feel, and act. It also helps determine how we handle stress, relate to others, and make healthy choices. So now that we've seen what mental health is and all the factors of mental health, we're going to take a look at mental health and how this impacts our overall health. Research shows that there's a correlation between mental health and physical health. Prolonged stress or low well-being can lead to other health conditions. Some of these health conditions include heart disease, type 2 diabetes, and insomnia. The health of our mind has a big impact on the health of our overall body. Another important thing to note with mental health is that those days when you're feeling like your mental health isn't doing all that great, that can also impact health habits such as eating regularly or other hygiene activities. Mental health changes over time and across our lifespan because of the factors that go into it, like emotional well-being and other psychological factors. It makes sense and it's normal if you find changes in your mental health, whether it's day to day or looking back on your life. Some factors that may impact your mental health short or long term are finances, your job or other household related responsibilities, physical activity or the lack thereof, food, sleep, changes in your health such as a new diagnosis, and pain. So mental health is an umbrella term. We can monitor and look after our mental health without having a mental health disorder or mental health diagnosis. A mental health disorder is something that is diagnosed by a doctor based on the DSM-5. Some common examples would be depression or anxiety. Mental illness can be caused by a disruption in mental health, a traumatic event, genetics, or a big life change. Mental wellness and mental health are something you can monitor to promote wellness in your life, and it's a way to process emotion. This is a great graphic from the CDC website. There's a lot of information here, and I'll try to go over some of it, but you may need to pause it if you want a deeper look at it. On the left, you can see that there is a column for mental health, and under that column are the known risk factors for mental health concerns. These include things like family history, stressful life conditions, presence of a chronic disease, a traumatic experience, and a few others. The middle and the right column are about chronic disease or chronic mental health conditions. There's a column in the middle that are modifiable risk factors. These include eating habits, physical activity, tobacco use, alcohol use, socioeconomic status, and other environmental factors. This middle column is showing things that may affect chronic disease, but that are partially modifiable. In the far right column, there are two factors that are non-modifiable, and these risk factors are age and family history. Following your stroke, you may experience changes in mental health. You may notice feelings that you haven't felt before, and so it's important to understand that this is normal and that there are a couple things that you can do to address this. It's important that you discuss these changes with your loved ones and your healthcare professionals. A stroke can impact mental health because it can be a traumatic experience, and also recovery can be a challenge each day mentally and physically on your body. About 32% of survivors of stroke have depression, and 25% experience anxiety, especially in the acute phase. The incidence of these mental health diagnoses is a great reason to remember to talk to your healthcare professionals and your loved ones about what you're experiencing. Now that we've touched on what mental health is, some signs of it, and some risk factors for mental health or mental health disorders, I think it's important that we touch on how we can take care of ourselves. I'll go over a variety of ways that we can take care of ourselves and our minds, but it's important that you find something that works for you because everything is very individualized. Some people really benefit from mindfulness activities. This includes activities such as meditating, prayer, and gratitude, thinking of what you're thankful for and what you have. Another way to promote positive mental health is to talk about how you're feeling. If this is something you'd like to do, it's important that you find someone who you feel comfortable sharing your emotions and feelings with, such as a loved one or a caregiver. If you're not interested in talking to someone about your feelings, journaling can be a great way to do this. If you prefer not to write but you're still interested in journaling, you could always find an audio app, such as one that you would find on your cell phone or computer, and just talk it out with yourself and record it in case you want to look back on it later. Managing stress is also an important factor in taking care of our mental health. A couple ways that you can do this is movement or exercise, participating in a hobby, being out in nature, or calling a family member or a friend. Last but not least, it's important to seek help when things seem unmanageable, or you experience a big change or swing in your mental health status. You can call your doctor's office or tell a loved one who's willing to do this for you. Here is a short self-check-in that you can do with yourself and just think about these questions. If this is something you like, you can do it on a regular basis, or you can come back and try this again later. The first question to ask yourself is, how am I feeling today, both mentally and physically? The next question is, what's taking up most of my headspace? Here you can reflect on what's on your mind, what's stressing you out. The next question is, am I tired? For this question, you could do a body scan and see how you're feeling in each area of your body, or just think about if you're physically or mentally tired today. The last question you can reflect on is, what will I do today that will bring me joy? Here are some of the resources I used to complete this presentation. I'll also link in the description a website that has a ton of resources if you're curious to learn more about mental health or if you're considering talking to your doctor more about this. Thank you guys so much for watching. I hope you enjoyed this video and learned something new and learned something that you might try out. Check out some of our other videos covering other great topics.